Welcome back to another Deep Dive Med. We're tackling those medications that target infections today. Antibiotics, antivirals, and antifungals.
Yeah, it's like a microscopic battleground going on, right?
It's kind of wild when you think about it. Like we're sending in these tiny warriors to fight off these microscopic invaders.
Exactly. And there are so many different types of these medications, each with its own unique way of attacking those microbes.
To help us break it all down, we're going to be diving into an excerpt from a pharmacology lecture. It focuses specifically on medications used for respiratory infections, which seems like a good place to start.
Definitely. Respiratory infections are so common, and knowing how to treat them effectively is crucial, especially for respiratory therapists.
Okay, so let's set the stage here. Our mission today is to understand the key differences between bacteria, viruses, and fungi. And of course, how those medications we talked about are used to treat them.
Sounds like a plan.
Now, one thing that's always puzzled me is fever. Does a fever automatically mean it's a bacterial infection? I've always kind of assumed that.
It's a common misconception. Actually, a fever is just your body's natural defense mechanism, no matter what's causing the infection.
Oh, really?
Yeah, think of it like this. Your body's like, hey, there's something in here that shouldn't be. So it cranks up the heat, like turning up the thermostat to try and kill off those invading microbes.
So it's not just bacteria that trigger a fever, viruses can too.
Exactly. It's a general response to infection, not specific to bacteria.
Interesting. So does that mean taking medicine to reduce a low-grade fever isn't always a good idea?
That's a great question. You see, it depends. A fever is a sign your body's fighting back, right? So sometimes it's better to let it do its job as long as it doesn't get too high.
I see. It's like sometimes our bodies know what they're doing and we just need to trust the process.
Exactly.
Okay, so let's move on to those infection-fighting medications. This lecture mentions tobramycin, which is inhaled. What's the deal with that?
Tobramycin is a powerful antibiotic. It's often used for people with cystic fibrosis because they often battle these chronic lung infections.
Oh, right. Makes sense.
And because it's inhaled, it goes straight to the source of the infection, right into the lungs.
That's pretty direct.
Mm.
Are there any special considerations when giving tobramycin?
Definitely. Always use a bronchodilator first.
Why is that?
Well, for a couple of reasons. First, it opens up the airways so the medication can actually reach deep into the lungs where it needs to go.
Makes sense.
And second, it helps prevent bronchospasms. Tobramycin can sometimes trigger those, and that's definitely something we want to avoid.
So it's all about maximizing effectiveness and minimizing side effects, right?
Got it.
Now, this lecture also talks about lab tests like gram staining and sensitivity testing. Can you break down what those are all about? I know they're important, but I'm not exactly sure why.
Sure. So imagine you're trying to open a door with the wrong key. It's just not going to work, right?
Yeah.
It's the same with infections. We need the right key, the right antibiotic to fight off the specific bacteria causing the infection.
And that's where these lab tests come in.
Exactly. They help us identify the culprit. So gram staining, for example, is a simple test where we add a special dye to a sample. Could be sputum, blood, or other bodily fluids.
I've heard of that. It has something to do with the color, right?
Yes. So gram-positive bacteria turn purple because their cell walls absorb the dye. Gram-negative bacteria, they have an extra layer of protection, so they don't absorb the dye and they appear pink.
Wow. So we can actually tell these tiny bacteria apart just by how they react to a dye.
Exactly. And it's super helpful because it allows doctors to choose the most effective antibiotic right away while they're waiting for more detailed test results.
I see. So it's like a first line of defense, a way to start fighting the infection as quickly as possible.
Exactly. And it also helps prevent unnecessary use of antibiotics that won't work, which is a big deal with the whole antibiotic resistance issue.
Right. Makes sense. Now, the lecture mentions some examples of gram-negative bacteria. Can you give us a rundown of some of the common ones?
Sure. Some frequent culprits in respiratory infections include Pseudomonas, Klebsiella, Legionella, and Haemophilus influenza. They can be tricky to treat sometimes.
Is that because they're gram-negative? Does that make them tougher to fight off?
Well, it definitely adds a layer of complexity. You see, gram-negative bacteria have that extra outer membrane we talked about, remember? It acts like a shield, making it harder for antibiotics to get through and do their job.
Ah, so it's like they're wearing armor. Now, what about gram-positive bacteria? The lecture mentions Staphylococcus, Streptococcus, and Diplococcus. Can you break those down for us?
Okay, so think of cocci as tiny little spheres, like microscopic marbles, right?
Okay.
And their names tell us how they're arranged. Staphylococcus, they cluster together like a bunch of grapes. Streptococci form chains, and Diplococci hang out in pairs.
I see. So their shape and arrangement give us clues about what they are.
Yeah.
This is all so fascinating. Now, I remember the lecture mentioning a few specific types of these cocci that are often involved in COPD exacerbations. Do you remember which ones those were?
Let's see, there was Haemophilus influenza, Streptococcus pneumonia, and Moraxella catarrhalis.
Ah, yes, those are the ones. And I think it also mentioned Pseudomonas aeruginosa and Staphylococcus aureus being common in cystic fibrosis patients, right?
You got it. Those are definitely ones to watch out for in those specific patient populations.
Okay, so we've talked about different types of bacteria, but how do antibiotics actually work to fight them off?
Well, there are two main ways, bacteriostatic and bactericidal.
I always get those two mixed up. Can you refresh my memory?
Sure, imagine a city full of bacteria just going about their day, multiplying and causing trouble, right?
Okay, I can picture that.
Bacteriostatic medications are like hitting the pause button on that city's growth. They don't kill the bacteria outright, but they stop them from multiplying. Gives your immune system a chance to catch up and fight back.
Ah, okay, so it's like putting them on hold.
Exactly. And good examples of those are medications ending in mycin or aceclin, like erythromycin or tetracycline.
Okay, got it. What about bactericidal? Those are the ones that actually kill the bacteria, right?
Yep. It's like sending in a demolition crew to wipe out that bacterial city. These guys work by disrupting the bacteria's cell walls, causing them to, well, basically explode.
Wow, that's intense. Are there any clues in their names, like with the bacteriostatic one?
Often you'll see them ending in aceclin or acef, like penicillin or cephalosporin.
Okay, that's helpful. Now, the lecture mentions vancomycin as a particularly powerful antibiotic. When would you use that one?
Vancomycin is our heavy hitter. We usually reserve it for those really tough infections that just won't quit, like gram-positive cocci that have become resistant to other antibiotics.
Oh, right, like MRSA, right?
Exactly. MRSA, or methicillin-resistant Staphylococcus aureus, is a perfect example. It's a nasty bacteria that's become resistant to a lot of the antibiotics we typically use.
That's scary. So how do bacteria even become resistant to these powerful medications? It seems like they shouldn't be able to.
Well, bacteria are incredibly adaptable, unfortunately. They're like tiny little escape artists, constantly evolving to survive.
So they're always one step ahead.
Pretty much. One way they develop resistance is by producing enzymes that actually break down the antibiotic. It's like they have a secret weapon that disarms our attack.
Sneaky little thing.
They are. And another way is by changing their protein binding sites. That's where the antibiotic normally attaches to work its magic. But if they change those sites, the antibiotic can't do its job.
It's like they change the locks on their doors so our key no longer fits.
Exactly. So that's why it's so important not to overuse antibiotics. We need to save the big guns, like vancomycin, for those really tough cases where nothing else works.
Makes perfect sense. Yeah. Now, switching gears a bit, the lecture also talks about pneumonia, which can be a real problem for people with COPD and cystic fibrosis, right?
Absolutely. Their lungs are already compromised, so they're much more vulnerable to all types of pneumonia, community-acquired, hospital-acquired, and especially ventilator-associated pneumonia.
Ventilator-associated pneumonia, what's that exactly?
It's also called VAP for short. It's basically pneumonia that develops in people who are on a ventilator.
Ah, I see. That makes sense.
The breathing tube provides a way for bacteria to get into the lungs, which can then lead to infection.
Yikes, that's not good. So what can we do to prevent VAP? It seems like a pretty serious complication.
Thankfully, there are a lot of things we can do. It's all about being really careful and paying attention to detail. Good hand hygiene is absolutely crucial.
That's a given, I would think, in any healthcare setting.
Definitely. And we also want to keep the patient's head elevated.
Oh, to prevent aspiration, right?
Exactly. And when inflating the ET tube cuff, we use something called minimal occlusion volume. It's the minimum amount of pressure needed to create a seal and prevent air leaks.
Interesting. So all these little things can actually make a big difference.
Absolutely. And there are other things we can do too, like using silver-lined ET tubes, which can help inhibit bacterial growth, and avoiding saline lavage before suctioning.
Saline lavage. Why would we avoid that? It seems like it would be a good thing to rinse out the airway.
You would think so, right? But it can actually push bacteria deeper into the lungs.
Oh, wow. I didn't know that. So regular oral care is important too, I imagine.
Definitely. And we want to minimize disconnections from the ventilator circuit as much as possible. Every time we disconnect, there's a risk of introducing bacteria.
Right. That makes sense. What about changing the ventilator circuit? How often does that need to happen?
Only when it's visibly soiled. We
Right.
don't change it on a routine schedule anymore.
So it's all about minimizing the chances of bacteria getting into the lungs. Seems pretty straightforward, but it sounds like it takes a real team effort to make sure all these things are happening.
You're absolutely right. It takes a village, so to speak, to prevent VAP.
Now, what happens if, despite our best efforts, someone does develop VAP? How is it diagnosed?
Typically, we'll do a bronchoscopy to get a sample directly from the lungs.
Right, to see what kind of bacteria is causing the infection. And then how do they decide on the best treatment?
We use a scoring system called the Clinical Pulmonary Infection Score, or CPIS for short. It helps guide our decisions based on things like temperature, white blood cell count, and what the secretions look like.
So it's a combination of clinical signs and lab results.
Exactly, and that helps us choose the most effective antibiotics to fight the infection.
Makes sense. Now let's talk about the potential downsides of antibiotics. Obviously, antibiotic resistance is a big one, but are there any other side effects we should be aware of?
Unfortunately, yes. Antibiotics are powerful medications, and they can sometimes cause unwanted side effects. Stomach upset, diarrhea, and nausea are pretty common.
Right. I think most people have experienced those at some point.
Probably. Some people also get dizzy or have allergic reactions. It's important to report any side effects to your doctor right away.
Definitely. What about that C. diff infection we hear about? Is that related to antibiotic use?
You bet. C. diff, or Clostridium difficile, is a type of bacteria that can cause severe diarrhea and inflammation in the gut.
I've heard that it's particularly nasty and has a really bad smell. Ugh, I don't even want to think about it.
Yeah, it's not pleasant. And the problem is antibiotics can sometimes kill off the good bacteria in our intestines, which can allow C. diff to take over and cause problems.
Ah, so it's like disrupting that delicate balance in our gut.
Exactly. And to make matters worse, C. diff is really tough to kill. Alcohol-based hand sanitizers don't work on it.
Really?
Nope. You have to wash your hands with soap and water to get rid of it.
Wow, good to know. So hand washing is still the gold standard.
It is, and it's another reason why we need to be careful about using antibiotics only when they're truly needed.
Okay, so we've talked a lot about bacteria, but what about viruses? I know antibiotics don't work on them, so what do we use?
For viruses, we have antiviral medications. They work by interfering with the virus's ability to replicate and spread.
So it's like putting the brakes on that viral joyride.
Exactly.
Now, are all viruses the same, or are there different types?
Great question. Viruses are classified based on whether they contain RNA or DNA. RNA viruses include influenza, HIV, and rabies, for example. DNA viruses include herpes, adenovirus, and the Epstein-Barr virus, which causes mono.
Okay, so different types of viruses. But do antivirals generally work the same way against all of them?
The mechanisms might vary a bit, but the general idea is the same. We want to stop those viruses from replicating and spreading.
Makes sense. Can you give us some examples of common antiviral medications?
Sure. A really well-known one is Tamiflu, or oseltamivir. It's often prescribed for influenza A and B.
I've definitely heard of that one.
It works by preventing the virus from releasing new viral particles to infect other cells.
So it's like trapping the virus inside its own little factory.
Exactly. And for herpes simplex virus, or HSV, we have medications like acyclovir, famciclovir, and valacyclovir.
No, those are the ones that treat cold sores and genital herpes, right?
That's right.
I noticed they all end in ivor. Is that a coincidence?
Nope. That's a little clue that tells you it's an antiviral medication.
Handy tip. I'll keep that in mind. Now, what about respiratory syncytial virus? That's RSV, right? I know that one can be pretty serious, especially in young kids.
Yes, RSV is a common respiratory virus. In adults, it usually causes mild, cold-like symptoms. But for infants and young children, it can lead to bronchiolitis, which is inflammation of the small airways in the lungs.
And that can make it really hard for them to breathe, right?
Exactly. And there's a medication called ribavirin that's sometimes used for RSV, especially in severe cases.
Is ribavirin an antiviral?
Yes, it is. It's given through a nebulizer, so it goes directly into the lungs.
Yeah, makes sense. Are there any special considerations with ribavirin?
Yeah, a couple of important things to remember. First, it's teratogenic, which means it can be harmful to a developing fetus.
So definitely not for pregnant women.
Right. And second, it can cause bronchospasm in anyone who inhales it.
Oh, wow, that's serious.
It is. So we always give a bronchodilator before administering ribavirin to help prevent that.
Makes sense. Anything else we should know?
Yeah, ribavirin shouldn't be mixed with any other medications in the nebulizer. It needs to be given on its own.
Got it.
And it's also important to use the right type of nebulizer. For ribavirin, we need to make sure those medication particles are super tiny so they can reach deep into the lungs.
Are there different types of nebulizers?
There are the SPAG machine, which stands for small particle aerosol generator, was used for a long time. But nowadays, mesh nebulizers are becoming more common.
What's the difference?
A mesh nebulizer uses a vibrating disc to create those tiny particles, while the SPAG uses a jet of air. Both work, but mesh nebulizers are generally quieter and more portable.
Interesting. So we've talked about bacteria and viruses.
Yeah.
What's next on our list?
Fungi, those are a whole different ballgame.
Right, I almost forgot about those guys. What are some common types of fungal infections and who's most at risk?
Well, fungal infections can affect all sorts of different parts of the body. You've got yeast infections, ringworm, athlete's foot. Those are all fungal infections.
Oh, right. I didn't realize those were all caused by fungi.
They are, and people with weakened immune systems are definitely more susceptible to these infections. Also, people who've been on prolonged antibiotic treatment or who use inhaled corticosteroids.
Why is that?
Well, those medications can disrupt the balance of microorganisms in the body, and that can create an opportunity for fungi to take hold. It's like knocking down one set of defenses and leaving yourself vulnerable to another.
Makes sense. So it's kind of a domino effect.
In a way, yes. And remember our earlier discussion about thrush.
Right. That white stuff that can grow in your mouth.
Exactly. Thrush is a classic example of Candida overgrowth. Candida is a type of yeast that normally lives in our bodies, but when it gets out of control, it can cause problems.
So are there medications specifically for fungal infections?
You bet. For thrush, nystatin is a common one. And for other types of fungal infections, you'll often see medications ending in azole or fungin.
Okay, so just like with the antivirals, there are clues in the name to help us identify them.
Exactly. But of course, it's always best to talk to a doctor for proper diagnosis and treatment. Self-treating can be dangerous.
Absolutely. Now, before we move on, I want to circle back to pneumonia for a moment. We touched on it earlier, but can you give us a bit more detail about the different types and why they're such a concern, especially for people with COPD and cystic fibrosis?
Sure. So as we mentioned, pneumonia is an infection that affects the tiny air sacs in the lungs. It can make it really hard to breathe.
And there are different types of pneumonia, right?
Right. One way to classify them is based on where you got the infection. So there's community-acquired pneumonia, which is the most common type. You pick it up out in the community, just going about your day.
Makes sense.
Then there's hospital-acquired pneumonia, which, as the name suggests, develops while you're in the hospital for something else.
Okay, so that one's a bit more serious, I imagine, since you're already in a vulnerable state.
Exactly. And then there's the one we talked about earlier, ventilator-associated pneumonia, or VAP. That one's a big concern for people on ventilators, especially those with COPD or cystic fibrosis.
Right, because their lungs are already weakened, so they're more susceptible to any kind of infection.
Exactly. And VAP can be really tricky to treat because the bacteria that cause it are often resistant to multiple antibiotics.
That's scary. So if someone develops VAP, how do they figure out what's causing it and how to treat it?
Well, usually they'll do a chest x-ray to see if there are any signs of infection in the lungs, and they'll take a sputum sample to try and identify the bacteria.
So it's kind of like detective work, trying to track down the culprit.
That's a good way to put it. And there's also a scoring system called the Clinical Pulmonary Infection Score, or CPIS, which helps guide treatment decisions. It takes into account things like fever, white blood cell count, and the appearance of the sputum.
So it's a combination of clinical observation and lab tests to figure out the best course of action.
Precisely.
Makes sense. Now, are there any specific things people with COPD and cystic fibrosis can do to try and prevent pneumonia in the first place? I mean, besides the general precautions we've already talked about?
Absolutely. Vaccination is key. They should make sure they're up to date on their pneumococcal and influenza vaccines. Those can really help reduce their risks.
Right. Those are important for everyone, but especially for people with compromised respiratory systems.
Exactly. And good pulmonary hygiene is crucial, too. That means regularly cleaning and disinfecting nebulizers and other respiratory equipment.
Well, that's a good point. I hadn't thought about that.
It's easy to forget about those things, but they can make a big difference.
So it's all about being proactive and taking those extra steps to protect yourself.
You got it.
Well, I think that's a good place to pause for now. We've covered a lot of ground today.
We have.
We talked about bacteria, viruses, fungi.
And the medications we use to fight them.
It's amazing how much is going on in our bodies that we're not even aware of.
It is. It's a whole microscopic world down there.
Definitely makes you appreciate the complexity of the human body and all the things that go into keeping us healthy.
Absolutely. It really is amazing, you know? All these microscopic battles going on inside us all the time.
It's like a whole secret world that we're usually oblivious to.
Exactly. And, we've talked about all these medications we use to fight infections.
Right. Antibiotics, antivirals, antifungals.
But we haven't really talked about our body's own natural defenses.
You mean like our immune system?
Exactly. The immune system is really the front line in this fight against infection. Medications can help, sure.
Kind of like giving our immune system a boost.
Yeah, that's a good way to think about it, but ultimately it's our immune system that does the heavy lifting.
Makes sense. So what's the immune system like? Exactly. I mean, I know it's important, but I don't really understand how it works.
Well, think of it like an army, right? With all these different soldiers that have specialized jobs.
Okay, I see that.
So you have these white blood cells like neutrophils and macrophages.
Those are the ones that like gobble up bacteria, right?
Exactly. They're like the frontline soldiers, engulfing and destroying anything that doesn't belong.
And then there are the lymphocytes.
Right. Lymphocytes are like the special forces. They're more targeted in their attack. There are T cells and B cells.
I've heard of those, but I'm not sure what the difference is.
So T cells are like the assassins. They directly attack infected cells. B cells produce antibodies, which are like little guided missiles that target specific invaders.
Wow, it's pretty amazing how it all works. So those are our defenses, and the medications we talked about earlier are like reinforcements, right?
Exactly. They give our immune system an extra edge in the fight, but a healthy immune system is the foundation.
Right. So all those things we talked about earlier, like eating a healthy diet, getting enough sleep, those are all important for keeping our immune system strong.
Absolutely. And there's one more thing that's really important that people often forget about.
Hmm.
Stress. Managing stress is crucial for a healthy immune system.
Oh, right. Because stress weakens our immune system.
Exactly. When we're stressed, our bodies release hormones like cortisol, and over time, high levels of cortisol can suppress our immune response, making us more susceptible to infections.
So it's like stress throws a wrench in the whole system.
Pretty much. So finding healthy ways to manage stress, like exercise, meditation, spending time in nature, those are all important for keeping our immune system functioning optimally.
Makes sense. And sleep too, right? I know sleep is when our bodies repair and regenerate.
Exactly. And that includes our immune system. When we're sleep deprived, our immune cells don't function as effectively, and we're more likely to get sick.
So those 7 to 8 hours of sleep are really important. It's like giving our immune system a chance to rest and recharge.
Exactly. It's like sending those soldiers off to boot camp to get ready for the next battle.
I like that analogy. Now, switching gears a bit, let's say someone does get an infection, despite their best efforts to prevent it. How do doctors figure out what's causing the infection? I mean, how do they know if it's bacteria, virus, or fungus?
It's like detective work. Doctors use a combination of clues to solve the mystery.
Okay, like what kind of clues?
Well, first, they'll take a thorough medical history. They'll ask about your symptoms, when they started, any recent travel or exposures, things like that.
So they're trying to get a sense of your overall health and any potential risk factors.
Exactly. And then they'll do a physical exam, listening to your lungs, looking in your throat, feeling for swollen lymph nodes.
Right, just checking for any signs of infection.
And depending on what they suspect, they might order some lab tests. Could be blood work, a urine analysis, or even cultures.
Cultures, like growing bacteria in a petri dish.
Exactly. It's a way to identify the specific type of microbe causing the infection. They take a sample of blood, urine, sputum, whatever's relevant, and they put it in a special dish with nutrients that bacteria or fungi love.
So it's like creating a little feast for the microbes to grow and multiply.
Pretty much. And once they have grown, we can identify them under a microscope or through other testing methods.
So that tells them exactly what they're dealing with.
Exactly. And that's crucial for choosing the right treatment.
Okay, that makes sense. Now, what about blood tests? I know those are often ordered when someone's sick. What kind of information can they provide about an infection?
Oh, blood tests can tell us a lot. One of the most common ones is a complete blood count, or CBC.
I've heard of that one.
It measures the levels of different types of blood cells. So, for example, an elevated white blood cell count often indicates infection.
Right, because white blood cells are the ones that fight off infection.
Exactly. And different types of white blood cells might be elevated depending on the type of infection. Like if it's a bacterial infection, neutrophils are often elevated. If it's a viral infection, lymphocytes might be more prominent.
So it's like the different branches of the immune army are being called into action.
That's a great way to think about it. And blood tests can also measure levels of inflammation in the body.
Inflammation, that's like the redness and swelling you see when you have an injury, right?
Exactly. And infection often causes inflammation too. So elevated levels of certain markers, like C-reactive protein, can point to an infection.
So it's like a signal that something's not quite right.
Exactly. And there are also specific antibody tests that can detect the presence of antibodies against particular pathogens that can help confirm a diagnosis or rule out certain infections.
Wow, so there's a lot of information that can be gleaned from a simple blood test. It's like looking for those telltale signs that an infection is brewing.
Exactly.
Now, let's say they've figured out what's causing the infection. How do they go about choosing the right treatment? I mean, there's so many different options, right?
Right. And it's not a one-size-fits-all approach. Treatment depends on a whole bunch of factors.
Right.
Well, the type of infection, obviously, but also the severity of the symptoms, the patient's overall health, any allergies or other medications they're taking. It's really about individualizing the treatment plan to each patient.
So it's like a puzzle, trying to find the best fit for each person.
That's a good way to put it.
So for bacterial infections, antibiotics are usually the go-to, right?
Usually, yes. But as we talked about earlier, choosing the right antibiotic is super important. We want to make sure it's effective against the specific bacteria causing the infection.
And we also want to avoid contributing to antibiotic resistance.
Exactly. And for viral infections, sometimes antivirals are prescribed, but they don't always work. And sometimes the best course of action is just supportive care, rest, fluids, over-the-counter medications for symptom relief.
So sometimes it's about letting the body fight it off on its own while making the patient as comfortable as possible.
Exactly. And then for fungal infections, there are antifungal medications. But as we mentioned earlier, treating fungal infections can be a long process.
And they can be tough to get rid of, right?
Sometimes, yes, and in some cases, surgery might even be necessary, like if there's an abscess that needs to be drained or infected tissue that needs to be removed.
Wow, so it can be pretty serious.
It can be, depending on the type of infection and how severe it is. But the good news is, we have a lot of tools at our disposal to fight these infections.
Right. It's just about using them wisely and appropriately.
Yeah.
Now, we've talked a lot about medications, but are there any other ways to treat infections, like non-pharmacological approaches?
That's a great question, and the answer is yes, there are. These approaches can be used on their own or in conjunction with medications.
So it's like giving the body an extra boost in its fight against infection?
Exactly. One example is hydrotherapy. That's just using water for therapeutic purposes.
Okay, like what?
Well, you can apply warm compresses to areas of infection. That helps promote blood flow and reduce inflammation.
So it's like soothing the area and helping it heal.
Exactly. And for respiratory infections, steam inhalation can be really helpful. It helps loosen mucus and makes it easier to cough up.
Oh, yeah. I've done that before when I've had a cold. It does seem to help.
Yeah, it can be really effective. And then there's aromatherapy. That's using essential oils for their therapeutic properties.
I've heard of that. Do essential oils actually work?
Oh, some of them do. Tea tree oil and eucalyptus oil, for example, have antimicrobial properties.
So they can actually help fight off infection?
They can. You can apply them topically or diffuse them into the air.
Interesting. I'll have to try that. What else?
Well, we can't forget about the importance of rest.
Oh, right, because when we're sick, our bodies need to conserve energy to fight off the infection.
Exactly. And proper nutrition is important too. Making sure you're getting enough calories and nutrients helps your body fuel those immune cells that are working hard to fight the infection.
It's like providing those soldiers with the ammunition they need. So it seems like there are a lot of things we can do, both with medications and with these non-pharmacological approaches, to support our bodies in fighting off infection. But ultimately, the best defense is a good offense, right? I mean, preventing those infections in the first place is key.
Absolutely. An ounce of prevention is worth a pound of cure, as they say.
Exactly. So what are some key things our listeners can do to reduce their risk of getting sick?
Well, we've touched on some of them already, but it's worth repeating because they're so important.
Absolutely. Repetition is key.
Okay, so first and foremost, hand hygiene. Wash those hands frequently with soap and water for at least 20 seconds.
It seems so simple, but it really does make a difference.
It does. And if you can't wash your hands, use an alcohol-based hand sanitizer. Make sure it has at least 60% alcohol.
Got it. What else?
Cover your coughs and sneezes. Use a tissue or your elbow, not your hand.
Right, because then you're just spreading those germs everywhere you touch.
Exactly. And don't forget about vaccinations. Staying up to date on your vaccinations is one of the best ways to protect yourself and those around you from preventable diseases.
Vaccines are a true lifesaver. It's amazing how they've helped to eradicate or significantly reduce the incidence of so many diseases.
Absolutely. They're a testament to the power of science and public health.
For sure. Okay, what else?
Be mindful of food safety. Wash those fruits and vegetables thoroughly. Cook meat to the proper temperature and avoid cross-contamination in the kitchen.
All good reminders. It's easy to get complacent with those things, but foodborne illnesses can be really nasty.
You're telling me. And finally, don't forget about the importance of a healthy lifestyle.
Right, eating a balanced diet, getting enough sleep, managing stress, all those things we talked about earlier.
Exactly. Those are all foundational for a strong immune system.
So it's like building a fortress from the inside out.
I like that analogy. It's about creating a resilient body that's better equipped to fight off those microscopic invaders.
Makes perfect sense. Well, I think we've covered a lot of ground in this deep dive into infections and their treatment.
We have. It's been a fascinating journey, exploring all the intricate ways our bodies defend themselves and how we can support those defenses.
Absolutely. And hopefully our listeners have gained a deeper appreciation for the complexity of the human body and the importance of taking care of ourselves.
That's the goal.
It really is amazing, isn't it, how all these little things, from what we eat to how much we sleep, can affect our susceptibility to infection.
It really is. It's like a domino effect. One thing impacts another, and it all ties back to our overall health and well-being.
Speaking of interconnectedness, something's been on my mind, and I wanted to get your take on it. We talk about the dangers of antibiotic overuse, right? And the scary rise of antibiotic resistance.
Right.
But what if we could flip the script a little? What if, instead of always trying to kill those microorganisms, we can find ways to work with them?
That's a fascinating thought, like turning our enemies into allies.
Exactly. Harness their unique powers for good instead of viewing them as just these things to be eradicated.
I mean, we're already kind of doing that in some areas of medicine. Have you heard of fecal microbiota transplantation?
Vaguely. It rings a bell, but refresh my memory.
So it's basically taking healthy gut bacteria from a donor and transferring it to a patient who has, like, a disrupted microbiome.
So someone whose gut bacteria are out of whack.
Exactly. And it's been incredibly successful in treating certain conditions, like recurrent C. diff infection.
Oh, wow. That's amazing. So it's like giving them a whole new set of gut soldiers to fight off the bad guys.
That's a great way to put it. And it's really exciting because it shows that we don't always have to fight these microorganisms. Sometimes we can actually team up with them to improve our health.
That's such a cool concept, like shifting from this mindset of war to one of cooperation.
Exactly. And there's so much research happening right now on the microbiome and its role in health and disease.
The microbiome, that's just the community of microorganisms living in and on us, right? Yeah.
Right. And scientists are finding out that these microbes play a role in so many things. Digestion, immunity.
I've even heard they could affect our mental health.
That's right. It's a pretty mind-blowing how much influence these tiny organisms have on us.
It really is. So it seems like we're just scratching the surface of what we know about the microbiome and its potential.
Absolutely. I think we're going to see some incredible breakthroughs in this area in the years to come. New therapies that target specific bacteria to improve health, prevent disease. The possibilities are pretty much endless.
It's exciting to think about. Well, on that note, I think it's time to wrap up this deep dive into the world of infection-fighting medications.
Time flies when you're having fun, right?
It does, and I think we've covered a lot of important ground today. We talked about bacteria, viruses, fungi, all the usual suspects.
And those amazing medications that we use to combat them. It's like a never-ending arms race, isn't it?
It is. But I think the most important takeaway for our listeners is the power of knowledge. Understanding these infections, how they work, how to prevent them. That's really the key to staying healthy.
I couldn't agree more. The more we know, the better equipped we are to make informed decisions about our health.
Exactly. And remember, you're not in this alone. You have a whole team of healthcare professionals ready to help you navigate the complexities of the microscopic world.
Absolutely. So don't hesitate to reach out to your doctor or other healthcare provider if you have any questions or concerns. They're there to help.
Well, folks, that concludes our deep dive into the world of antibiotics, antivirals, and antifungals. We hope you found this episode informative and empowering.
And maybe even a little bit awe-inspiring. Those tiny microbes are pretty amazing when you think about it.
They are. They're a constant reminder that there's a whole universe happening right beneath our noses.
Until next time, stay curious, stay healthy, and keep exploring the fascinating world of medicine.
And be sure to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.